Hey, it's Dr. Chad here. I want to welcome you to your doctor's report, which is your most important appointment here at our office. This is the appointment where we're going to go over everything from A to Z as far as what it's going to take to help you to be healthy through principled chiropractic care. Many people out there don't know really what chiropractic care is. So after your first visit, hopefully you understand that it's not how you feel, but it's how you function. And so the reason why we say that is if you look at all the healthcare statistics, you look at the United States, we're one of the worst countries in the world as far as how healthy we are and how long we live. And the reason for that is we do everything in our healthcare system by how we feel. We base it off of symptoms. And so if you look at all the nerves in your body, what percentage of the nerves in your body are dedicated to how you feel? It's only 10%. So nobody wants to think 100%, but it's only 10% of the nerves in your body dedicated to how you feel. So what's really important for you to understand is that we are focusing on function. And the way that your body is created is that you started out as one cell, and that cell divided and divided and divided. And the first thing created was your brain and your spinal cord. And in our office, we have a very important thing that we go by, and that's the above, down, inside out approach to health, which is what chiropractic's main focus is. We don't try to make you feel better. Our goal is to make sure that that function is happening at 100%. If that is the case, your body will be able to adapt and to heal the way it's created to. So if you understand how your body is created, you'll understand how we can actually help you function. And chiropractic is the only profession in the world that focuses on how your body heals from the inside out. Nothing in your body heals from the outside in. So healthcare, the reason why in healthcare we are so bad in the United States is because we keep trying to cover up symptoms. So the goal of your first appointment was to figure out exactly where your dysfunction was happening in your body, so that today we can go through step by step how we're going to be able to serve you and help your body function better. So when we talk about symptoms, that is the last thing that will show up. Research tells us it takes about 40% pressure on a nerve before you ever feel the first symptom. So it takes a lot of pressure and a lot of stress on your body before you actually end up producing a symptom, especially when only 10% of your nerves are dedicated to how you feel. So we're heavily focusing on your function to make sure that we can serve you and produce the best quality care that you hopefully want for you and your family. So next we're going to get into your x-rays specifically in your neck that can explain why this issue can be going on in your spine. Okay, so when we're going over x-rays, this is probably the most important thing that we do in our office. So when we're looking at your spine, we never want to go in there and start adjusting or giving you chiropractic care without seeing exactly what's going on with your x-rays. When we look at a side view of an x-ray, there are rules that we talk about as far as what we need to see and what we don't want to see. The question is, should we have a curve or should we not have a curve when we look at the spine from the side? So from your tour, you should know that we are supposed to have this beautiful 30-degree curve, banana-shaped curve in your neck. So that's ear directly over the shoulder. That's why we took your postural assessment on your initial visit. When we take x-rays to see, based on this abnormal posture, do you have structural problems because of abnormal posture? So the first thing is, do you have this curve or do you not have a curve? The next thing is, we want to see equal disc spacing between the bones. So whether we're looking at the side view of your neck, which is what this is, or if we see a side view of your low back, we want to be able to see that every disc is exactly the same thickness. If it's not, we'll talk about that in a minute, but that would be abnormal. That would mean that's where your body is getting beat up, wear and tear, stress-wise. So on this initial x-ray that we took of Stephanie, there's a lot of things that we're going to go over, but the biggest is you can see that the curve is actually going in this direction. So it's not that hard to understand that if you're on your phone or if you're working at a computer, or maybe you work with kids and your head's like this all the time, some of the moms out there, that's what gets and creates that posture. This can happen from a car accident and some other traumas, but most of the time, this is from repetitive things that we do every single day. That is abnormal, but over time, if we start seeing the disc spaces, so follow along, if you see these discs, these two are normal, they're the same thickness, and then these two are way smaller than they should be. And at that exact moment, we say that's degenerative disc disease or spinal arthritis. So if you look at an orthopedic textbook, how many years do you think it takes for a wear and tear or an irritation to a joint? How many years do you think it takes for that to show up on an x-ray? You think it's 5, 10, or 20? Well, the research says it's 10 to 15 years is how long it takes of irritation and wear and tear on a joint before it ever shows up on an x-ray. So you may have come into our office with a pain or a discomfort that's been a week or a month or maybe a year, but then we look at your x-rays and you have significant degeneration. Well, that tells me this isn't a month problem. This is years, and sometimes people it's decades, because this, according to medicine, is a lot longer problem than what most people are considering. And what's amazing about the body is it's been trying to heal and adapt to that inflammation for a long time, but over the course of time your body can only do so much, and then it produces the symptom, and then now your body is telling you you need to take action and do something for that degeneration. So when we see that degeneration, there's actually the beginning of growths on the front of that bone. So on your x-rays, if you have degeneration, you want to look and see if there's this extra bone growth, and that's actually a bone spur. And the research on that says that can take another 10 or 15 years for a bone spur to develop. So for many of you, this problem that you have has been there a lot longer than you think, and the x-rays tell me exactly how long that problem's been there. So please understand, when we see this x-ray, to get from here to here, that didn't take a week or a month. That took time and repetition. And that's the second most important thing about our office after the above, down, inside, and out philosophy is that healing takes time and repetition. They say Rome wasn't built in a day. Well, healing doesn't happen in a day. It has taken a lot of time for your body to get into this position, so it's going to take that repetition to actually correct the spine. Have you ever had braces before? You would never say to your orthodontist, I know you said 2 years, I want you to fix it in 2 months. They would literally look at you and laugh, because it's not possible to correct that much structural damage in 2 months. So when we look at your x-rays and when we go over our recommendations, you're going to see that time and repetition aspect is the most critical part of your care. Just like when you work out, you can't just go work out once or twice and expect to have a totally different looking body or to be in really good shape. That takes time and repetition. And chiropractic care, the care that we provide called corrective care, is exactly like that. But on the front to back view, we never want to see what we're seeing on this x-ray here, and you probably know what this is. It's called a scoliosis. When you were a kid, if you ever had a scoliosis, the doctor, there's only 2 things they can do. One is surgery, which surgery is only if it's a severe 40 or 60 degree scoliosis. The other option is they'll brace you, and with bracing it, the research shows it doesn't improve the scoliosis, it just prevents it from getting worse. And so the goal of what we try to do is to not ever just leave anything like it was. You would never go to the dentist and they say, you have a cavity, just work really hard the next 6 months to a year and you can actually make that cavity go away. No, that has to be fixed. There has to be something that intervenes to correct that. So when we're looking at the structure of your low back, we want to see that should be perfectly straight up and down. There should be no deviations left or right. And so the pelvis should be perfectly balanced. We shouldn't see left or right higher than the other. We want to make sure we know 100% where the cause of the issue that you're having is stemming from. And for most of you, it's going to be stemming from your spine. And our job is to correct that with specific scientific chiropractic adjustments. Our team's whole goal is to make sure that you understand without a shadow of a doubt what is going on, and that chiropractic will be the answer for you. Because if you have proper structure, you will have proper function. If you have really bad structure, if your posture is not great, it's really hard, almost impossible for your body to have good function. And so everything that we do with the adjustments and with postural exercises, the goal of this is that with time and repetition, just like my body, just like all of my team members here, their bodies have healed with time and repetition. And with that, if you look at Forbes magazine, you ask people that retire, what is the number one regret that you have now that you're retired, looking back? And you know what they all say? Every single one of them, they have the car, they have the house, they have all the money to retire. They don't have their health to enjoy all the things they hoped they were going to be able to do. So it's never a bad time to start investing, no matter how young you are or how old you are. The time is now to start saying, hey, well, I have these structural issues in my body that of course are creating these symptoms. And so from this point on, the goal is that if we start correcting that, just like with braces took time and repetition. And when you take the braces off, you have to wear a retainer to make sure that those teeth don't shift anymore. And so the goal of this is that we have your best interest in mind and that your body is going to be able to heal. And more than anything, this is to encourage you. And our team is always going to encourage you in this journey, because this is difficult to say, hey, I'm going to make sure that my body is going to be able to overcome. And that takes time and repetition, but we're going to be with you every step of the way. And I'm going to be in just a minute to go over x-rays with you, and I can't wait to get your first adjustment, but we're looking forward to serving you and seeing great changes and victory in your health.